Well, thank you for having me. And Jen, I could never say no to you. So whatever you want, I'm there. Although if I have to get on the spin bike again, that might not be so pretty.
One
But
class, one
yeah.
class. Then she was like, this is not for
Yeah,
me.
not for me. Anyway, I at Sutter in Davis, I've been there for over 20 years, which is kind of crazy to think about. I was their first dermatologist, the first dermatologist there. And now, of course, when I joined Sutter, we were a little group and I was their only dermatologist. Now we're a big, huge, big, huge corporation, really. But the truth about being a dermatologist for 20 years is that you accumulate a lot of, I say accumulate, that's not a nice word, but most of my practice now is skin cancer. And it wasn't that way at the beginning, but it becomes that way over time if you're doing what I do, which is medical dermatology. So I don't do any cosmetic stuff. I don't do anything fun and exciting like that. I really just do a lot of skin cancer work. And so, once you diagnose someone with skin cancer, they kind of end up being your patient for as long as they want to. But honestly, until they get insurance or move on or move somewhere else, but so over the years, you really do, your practice just kind of goes that way. So honestly, I spend almost every day treating cancer and seeing cancer patients, and that's kind of the majority of what I do now. I still like to do acne and other general dermatology concerns, but it ends up being a lot of skin cancer, and we're here in Northern California, so I have a lot of people who've had a lot of sun exposure in their lives, and so I love our patient population. Actually, it's really fun. So I have a slideshow. I'll show it. I mean, a lot of the stuff I feel like I'm going to say sound is pretty straightforward, but hopefully it, is helpful and interesting anyway. So I'm going to share my screen if I can do this right. I'm very I'm a dinosaur, as my children like to tell me. So let's see.
Hmm.
Share my screen, and then I'm going to start my talk here. So yeah, mostly I'm going to focus on skin cancer. And number one, and I don't think this is so much of an issue around here. Really, I feel like people are very health conscious, but tanning beds aren't good for you. Sadly, in the news lately, I've heard that there's some talk about uh, making tanning beds. It was banned for teenagers, and they're talking about undoing that, which I think is a real shame because it's an incredibly addictive thing to do. It's as addictive as cigarette smokes because ultraviolet light does make us feel good, and so tanning beds um, can be particularly bad, especially if you start them young, and you really do increase your risk of skin cancer when you use tanning bed. Um, and I'm a big believer in using the fake tan. I think it works great. I think if you're like me, you grew up in the 70s and the 80s, and you like the look of having a tan. I think the sunless tanning products that are available now are really quite sophisticated and nice, and you can find products that don't turn you orange and that don't smell too bad. And I think they work pretty well and I would much rather see someone use fake tan than a tanning bed, for example. The only caveat is that if you do get one of these spray tans or do a tan, you're not going to be protected from ultraviolet light when you go to Hawaii or something like that. So you can still get a burn. Um, this is probably pretty self-explanatory, but sunscreen use I do think is important. We live in a place where we probably have more than 300 days of sun per year. And so I think just the everyday life of walking to and from places in your car or the grocery store, we really do get a lot of cumulative sun exposure over time. And so I'm a big believer in using sunscreen, even if it's cloudy, even in the winter time. Even if you don't think you're going to be spending a lot of time outside, I would say focus on your face and arms, especially the places that will get sun exposure. And I'll talk more about sunscreen on some future slides. And people often ask me what sunscreen, like they want me to give them a specific recommendation. And I always say pick the one that you don't mind putting on every day because if you don't like it, if it's hard to rub in, if it's greasy feeling, you're not going to use it. And I always give the example of my own family. There are four of us, and if we travel, we have to bring four different kinds of sunscreen because everybody has their own sunscreen that they like. And so it really is kind of a personal preference. Um, when we talk about sunscreen, we talk about main forms of ultraviolet light that come to the Earth's surface, UVB and UVA. UVB used to be thought of as the one that caused, the only one that we had to worry about for skin cancer. And it's true, UVB does cause burning, whereas UVA is really more responsible for it. It penetrates into the skin more deeply and it can cause more photoaging. And interestingly, going back to tanning beds, the tanning bed industry has always advertised themselves as being safe sun, and that's because they use a greater percentage of UVA light. So going back in time when we thought UVB was the only bad form of light, we know better than that now. And I think if you know people who do a lot of tanning with tanning beds, you can see they have more photo aging as a result of that increased UVA light. I get lots of questions about sunscreen, lots of concerns about the chemicals in sunscreen, and um, personally, I think it's because of what I do for work. I see so much cancer that I know ultraviolet light is bad for you. I know it causes skin cancer. People ask me about the chemicals in sunscreen. My general feeling is like, well, they might harm you in like 200 years, but I know that ultraviolet light is going to be harmful for you, sooner than that. Um, but, I understand people's concerns as well. And there are some good resources out there if you want to look up sunscreen. And the Environmental Working Group is one that puts out their annual list of sunscreens. 20 years ago, when they started doing this, the only sunscreen they recommended was something called Badger. They sold it at the co-op and it was like zinc paste and it was terrible. But now I just looked at it recently and they've got lots of recommendations on there if you're concerned about using chemical sunscreen. You can also read labels. There's chemical sunscreens versus physical sunscreens. The physical sunscreens are zinc and titanium, and so those tend to be considered more safe. And they also are very broad spectrum, so they cover both UVA and UVB light. And on sunscreen labels now, most of them do say broad spectrum, so it's important to know that you're getting protected from both UVA rays and UVB rays. And honestly, almost all sunscreens do that now. So it's pretty, it'd be hard to find one that didn't. And I'm also a big proponent of using other forms of protecting your skin from the sun. I actually think they work a lot better than sunscreen, and a lot of people don't really like sunscreen. Sun protective clothing now is so readily available, and the fabrics have gotten to be so good. I personally carry this white button-down shirt that is sun protective. We travel to Florida to visit family. I wear that shirt when I go walking. I wear that shirt when I'm at the beach. I don't even have to think about putting sunscreen on my back because I just have that shirt on. Wearing a hat, not just a visor if you're out there playing golf or something. Scalp is pretty miserable. So, protecting the top of your head from the sun. Sunglasses also are light. Our eyes can be affected by sun. And then picking the right time of day to go out into the sun. If you can choose the hour of day that you go swimming, don't make noon, make it like 9 a.m. or 4 p.m. and then try to avoid a chunk of time in the middle of the day. I get a lot of questions about supplements, and I don't consider myself an expert on supplement at all, but there are a couple that I do think are pertinent to skin cancer and what I do. Nine is vitamin B3, and there have been some good studies that have shown that in people who have had skin cancer and people who have a lot of sun damage, that you can reduce the risk of skin cancer 25 to 30% in high risk patients. So it's safe, it's accessible, um, it's well tolerated, and unlike niacin, it does not cause flushing. Another one is called polypodium. This is also known as HelioCare. This is, I think, of like an oral sunscreen product. If you're going to be out in the sun, it's a nice thing to take. I think you take it in the morning. It lasts for about 4 hours, so you would take it again in the middle of the day. So it's kind of like putting on your sunscreen, and it can really reduce sunburn. I think it was developed in Australia or New Zealand. We were in Hawaii a few years ago. My husband, who's had skin cancer in his 20s and has burned every time he goes even if he tries with sunscreen, and he took HelioCare and he never got burned. So I was impressed. So I also recommend this occasionally. I don't think it's something you need to take every day, but if you were going to be out in the sun or in the summertime, it'd be a good choice. Um, just more reason to protect your skin from the sun is that it can cause aging. I love these pictures that show these split faces of people who really had a lot of sun exposure through the window. We used to think that glass protected you from the sun, but now we know that that UVA light really penetrates windows. And probably the thing that my elderly patients complain to me the most about is the bruising on their arms and thin skin, and they bump into things and they bruise. And that all comes from sun damage over time. So if I can emphasize, protecting your arms, wear sleeves when you're outside doing things, or use sunscreen. And again, ultraviolet light really contributes to aging. Um, Things to prevent aging. I don't do a lot of cosmetic dermatology, but there are simple things that can help improve your skin. Number one being sunscreen, not smoking, things like that. A retinoid applied daily can be helpful with photo aging to some extent. It's probably the one topical that has some benefit. And a lot of the over-the-counter products are quite good, like Neutrogena, Rock. I don't think you have to spend a lot of money on these products. You can get, if you tolerate the retinol, you can try over-the-counter Differin, and that is in the acne section, usually in the pharmacy. And if you're tolerating even that, you can get a prescription from your dermatologist as well. But if you start right off the bat with tretinoin, skin will get red and peel, and it can be difficult to tolerate sometimes. Um, you know, I get frustrated looking at between the commercials and then also influencers and social media. People spend a lot of time talking about special skincare. I think a lot of people say they love thinking about skincare. But honestly, I think a lot of it is unnecessary and expensive. So I would say just be careful where you get your information. So on to talking more about skin cancer. Skin cancer is um, just so common, and more people are diagnosed with skin cancer each year in the United States than all other cancer combined. 1 in 5 Americans will get skin cancer by the age of 70. More than 2 people die from skin cancer in the United States every hour. But the good news is that, especially when it comes to melanoma, which has the highest mortality rate of the skin cancers, is that when detected early, the survival rate can be really good. And we can see over the last 30 years or so, the rate of death from melanoma has not changed, but our rate of detection has really skyrocketed. So we're picking it up earlier than we used to, and we have a better understanding of what to look for. And we have better treatments also for some of the later stages of melanoma as well. So this is what I definitely see every day is kind of the bread and butter of what I do every day is treat non-melanoma skin cancer, which includes precancerous lesions, basal cell, squamous cell, and Merkel cell carcinoma. These are skin cancers that really are linked with sun exposure. Merkel cell carcinoma is much more rare, and actually it is probably the most aggressive form of skin cancer with a very high mortality rate, and so thankfully it is quite rare. Again, another example of a cancer that's really increasing over these last 25 years. When I was in residency, I think I saw maybe 1 or 2 cases. I've seen it a few more times now. Recently, got a blip in the news because Jimmy Buffett died of Merkel cell carcinoma. This is a cancer, he's kind of the prototype. It's more common in men than women, elderly people, people who've had a lot of sun exposure in their life and tend to have more fair complexion with the Merkel cell skin cancer. So basal cell is the most common type of skin cancer. I don't go to work without seeing basal cell skin cancer every single day. The good news is it's slow growing, it's very curable and treatable, but it can have a lot of detrimental effects on people, especially when it occurs on the face. And it can be difficult to detect. A lot of times people don't even notice basal cell because it's pretty asymptomatic. When basal cell occurs on the face, I usually send people for something called Mohs surgery. That's done by a dermatologist like myself, but then an extra training in skin cancer surgery. And what they do is they cut your skin cancer out with local anesthesia. They put a bandage on you. You sit in the waiting room. They take your piece of skin and they map it very precisely, and they look at it under the microscope and they check all the margins all at once and make sure that they've cleared the skin cancer before they stitch you back together. So it's a real tissue sparing type of treatment to take the least amount of your normal skin as possible, but to know that they've cleared the cancer completely. And a lot of times you walk out of there with a lot of stitches on your face, and it can be very traumatic for people. So it's, even though it's a, non-aggressive kind of cancer, it can have, serious consequences for people as well. And then squamous cell carcinoma is a little bit less common. Um, Actinic keratosis are precursors usually to squamous cell skin cancer. I probably see those every day, and we treat those in various ways with creams and liquid nitrogen and things like that. When people have a lot of precancer spots, for me, it's more of a marker that they're at risk for skin cancer. I'm not so worried about actinic keratoses by themselves, but that knowing them, people have them, that their risk of cancer is greater. And so we keep a closer eye on them. Um, Squamous cell carcinoma can grow quickly and it can be more aggressive. It can metastasize. And I tend to think of squamous cell carcinoma as occurring in my older patients, whereas basal cell can occur in people 30, 40 years old, and older, obviously. And then squamous cell would be pretty unusual under the age of 50, unless you're on medicine that suppresses your immune system or a transplant patient. They are at much higher risk for squamous cell carcinoma. And there are a lot of these new medications out there that do suppress our immune system that people are on for other various autoimmune diseases. So I do monitor a lot of patients now more than I used to, because of these medications, and because of this slightly increased risk of squamous cell skin cancer. On the face also would be treated with Mohs surgery. And then melanoma, I think when we think about skin cancer, most people think about melanoma. And a lot of times people use the term melanoma for the generic term of skin cancer, but obviously melanoma is its own form of skin cancer. It's a cancer of the melanocytes, or the cells that make the pigment in our skin. And it's not nearly as common as squamous cell and basal cell. Like I go to work every day, I see basal cell, I see squamous cell pretty commonly, but melanoma not nearly as commonly, thankfully. Um, and we talk about the ABCDs of melanoma. So looking for, what does a melanoma look like? It's usually a spot that looks really ugly. And if I showed you a picture of somebody's back and there was a melanoma on there, you'd be able to pick it out because it doesn't look normal. It's got a funny asymmetrical border, or asymmetrical with a funny border, multiple colors. The diameter is not so important, I would say, but something that's growing and changing is what we're looking for, and what I tell patients to look for if something changes over the course of several weeks or a month or two. Um, and the other thing about melanoma is that it's less likely to rise in a mole that already exists. It's more likely to show up as a new lesion. So I usually tell people, when you're looking at yourself, pay attention to things that are new and changing. Um, People at increased risk for melanoma are redheads, people with fair skin, people who have a lot of moles. If you have more than 100 moles, you have an increased risk of melanoma. If there's history of melanoma in a first degree relative, and then a history of using tanning beds and burning and things like that as well. And just to remember that melanoma, I say it's more common in fair-skinned people, but it can occur in all skin types. And, probably, thinking about someone like Bob Marley, who died of melanoma at age 36, his appeared as a dark spot under his nail, and it wasn't picked up right away, which unfortunately happens to people with skin of color because, a lot of times we're not thinking about melanoma when you have dark skin. The acral or under the nail melanoma is the most common type of melanoma in people of color. So this is what I recommend for my patients. There's the self breast exam for women out there. There's also the self skin exam. And I usually tell people once a month, get naked and deliberately look at yourself and know where your spots are. Get out mirrors and, look at your back, look at the bottom of your feet if you can, and know where your spots are. Because again, melanoma is going to show up like something, it usually shows up as something new. And so if you see a new dark spot and you see it again and it's bigger the next time, that would be something to have checked. If there's a sore that just doesn't heal, sometimes people think, oh, it was a bug bite, but then a couple months later it's still there. That can be a sign of like a basal cell skin cancer, a painful lesion growing quickly. Those people usually call pretty fast, but that can be a sign of the squamous cell skin cancer. Um, and thankfully, not all new spots are bad. I mean, I go to work every day and I have messages in my in basket asking me to see people for spots that they've noticed that they're worried about. And most of the time, they're these seborrheic keratoses or barnacles or birthday presents, I like to call them. Some people get a lot of these cherry angiomas. These are red spots. Sometimes they can clot and look purple or almost black. And so sometimes people call me with a new black lesion, and thankfully it turns out to be one of these angiomas. Liver spots or lentigines, and then of course skin tags, all lovely things that happen as we get older. And you can see up in the upper left, the seborrheic keratoses. I mean, they look like an ugly duckling. And so I would not expect anyone to know the difference between a melanoma and a seborrheic keratoses. I really don't mind, fitting people in for a spot check so I can take a look at these and be sure, or biopsy if necessary. Um, and then, vitamin D is in the news a lot lately. It's been being, people are having this checked a lot more frequently, I think, than they used to. And this idea that we need to sit in the sun to get vitamin D. Um, you know, for most of us, the living here and being outside the amount that we are is all that you need to convert that vitamin D into its active form. So you don't really need to sit in the sun to get your vitamin D. And lots of people, I think, like to say that because we all like to sit in the sun, but it's really not something that's necessary to do in terms of, uh, trying to get your vitamin D activated. Another issue that I see all the time is people are itchy and dry. So as we get older, our skin gets drier. Products we may have used for years and years suddenly don't really seem to work as well anymore. I'm a big believer in just really gentle cleansing, washing only your critical body parts. You don't need to exfoliate, your skin can do it yourself. And moisturizing after every shower, that will trap water in your skin. And if you use creams and lotions, they really do work better because they penetrate into the skin and trap water. They work better than oils and ointments and things that create an evaporation barrier. They help, but they aren't as good actually as creams and lotions. And if you apply while the skin is damp, it really does help trap some of the water in your skin. I tend to like products that don't have a lot of extra scent and extra ingredients because I have a lot of patients with really sensitive skin and eczema and things like that. Havana Cream is a nice brand. Um, uh, CeraVe, Cetaphil, Dove, gentle products like that. If did you have an appointment for a skin check? I always like to tell people think about lesions of concern before you go in. It really helps me because I'm doing a full skin check and usually I'm looking at you. And if I see your keratoses on your back, I'm not going to think to tell you about them. But if you're worried about one of them, you'll think I didn't look at it. So it's good to point things out. And also it's good to know history of individual lesions. Like if something has bled, that usually really catches my attention. And I look very carefully at those types of spots, knowing where your spots are so you can ask about them. I know it's incredibly awkward to be standing there under fluorescent lighting without your clothes on, but honestly, we do it all day long, and it does take a little getting used to. If you can come without makeup, that's really important. Unfortunately, a lot of patients don't take their makeup off, so it is difficult to see under makeup. So if you're thinking about that, having a clean face, and if you want your nails examined, to have nail polish removed as well. Um, and uh, just a plug for board certified dermatologists who spend all our time and years and years and years and years of training to get to the point to be able to look at your skin and help diagnose things like skin cancer. So in summary, wear sunscreen every day and also use other ways to protect your skin from the sun. Stay out of the midday sun as much as possible. Look for things that look strange and unusual to you, or if you have a lesion that doesn't heal right, or something that bleeds or hurts, those are things to draw a doctor's attention to. Moisturize and use gentle soap, doing monthly self-skin exams, and trust your skin to a board certified dermatologist. Thank you. All right. Hopefully I didn't talk too fast.
No,
But
that was
yeah.
amazing.
Thank
So
you.
Oh, thanks.
helpful.
Yeah.
That was amazing.
Oh,
I
thank
did.
you. I hope I did. I feel like I'm rambling on. It's weird to be talking to my own screen. So, so anyway,
Yeah, because you can't really see our faces. You mostly can see the
no, I
slide,
wish I
right?
could have seen faces, but anyway, no, it's good. Yeah.
Well, I'd love to, if it's okay with you,
Yeah.
Dr. Zavod, um,
Mhm.
if just feel free, you guys, to unmute yourself and ask questions. I do have a couple of questions that I got to me from the chat, but I want people that are on the call first to have an opportunity to ask you some questions. So please feel free to unmute and ask away because this is really good information. Anyone?
Me. Hold on.
Hello.
Yes,
I'm
please.
I'm curious about the pill that you said that you take or your husband takes before he goes out into the sun.
Yeah,
So that helps with burns or
it helps with burns. So it's like an antioxidant and derived from this plant, a fern, and it's not one I necessarily recommend taking every day. Unlike the niacinamide, which I really do think you could take every day, it is there to help prevent skin cancer, and there's some evidence to show that it does do that. Whereas HelioCare is like this temporary sunscreen, like an oral, I think of it like an oral sunscreen. So it works after you've taken it to help your body kind of fight off the free radical formation, in the skin. And so but it only lasts for a few hours. So if you know you're going to be going somewhere in the sun, or you're going to be, like I said, we were in Hawaii, um, and we took it then, or going to Florida or someplace sunny, you know you're going to be in the sun, or if you know you're going to an event or, be outside all day, you could take the HelioCare to kind of protect your skin from the sun. They do make an advanced HelioCare, which contains niacinamide and HelioCare, and the polypodium.
and this is
So if
over
you
the
wanted to
counter?
take one, one thing, you could have them both in one. But I don't think you need to spend the money on the HelioCare to take it every day, unless
Okay,
you
just
really are
like if you're
someone who's
going on a
working out.
tropical vacation or
Yeah,
and
exactly. That's what I
that's
think
an
of it for. Yeah.
that's an over the counter one.
It's over the counter. It might be a little bit hard to find, but I have looked for it. Like CVS does carry it. So if you wanted to find it locally, you could. I bet Target carries it. But I don't think you could find it like at every CVS. It might be a little bit hard to find. And of course, you can always order it online. The niacinamide's everywhere. Like that would be it. I've seen it at Co-op and things like that.
So do you take that in conjunction with a sunscreen?
Yes. Yeah. By itself, it wouldn't be enough. In fact, I didn't want to try it out. I've not, put myself out there to try it, but by itself, I don't think it would be enough. Like if you went out and sat in the sun after HelioCare, you would probably still get a burn if you didn't protect yourself from the sun somewhat, but it might give you a little more time or a little bit less of a burn. I also recommend it I have patients who have diseases that sensitize their skin to the sun a lot, like lupus and things like that. And HelioCare has been shown to help them not have flaring because of ultraviolet light. So sometimes I recommend it for patients like that, or people who there's something called, polymorphous light eruption. So when you go out into the sun for the first time, you can get a rash. So it can help with things like that. And it might even help after sunburn. I mean, I hate to see people get a sunburn, but if you had a sunburn, I have heard that some people take it kind of as a post sunburn treatment as well. So, you know, if you forgot the sunscreen and needed something, it might help you, if you had a burn.
Thank you.
Are these something that we would ask our oncologists about?
Yeah, that's a good idea, honestly, especially the niacinamide, making sure that it's okay, that they're okay with you taking a supplement like that, for sure. I would say that.
Thank
Uh,
you.
there have been a few reports of people, I mean, with the niacinamide, I had stopped recommending it for a while out of concerns for potential side effects. But then some more data came out that showed that it really was quite helpful for people who've had skin cancer. So now I've kind of gone back to recommending it mostly to my patients who've had skin cancer. Um, but it's not completely without, risk because it's, an oral supplement. And so you always want to make sure that you're not going to have some interaction with something else that you're already taking. So, no, I would definitely run it by your oncologist or other physician as well.
Okay, thank you.
Yeah.
Yeah, really good question. I have a question personally.
Yeah.
So I'm not with Sutter,
Yeah.
and I have a grandmother who died from melanoma. I have a sister who has had a very significant melanoma.
Okay.
And
Yeah.
I cannot get a check without a real concern. One of the things that
Yeah.
you noted was that
Yeah.
you could get an annual check, and it's something that
Yeah.
I've tried and tried, and I finally just paid out of pocket
Yeah.
and
Do you
had
have
it.
Kaiser out of curiosity, or you don't have to tell me? But so some places, like I'm not throwing, and they are such a big medical group around here. They just have these guidelines and they don't bend. And unless you have had, I've heard from patients of mine who've come and gone, because nowadays people have to change insurance, all the time,
Right.
that that unless you've had cancer yourself, you really cannot get an appointment with a dermatologist. So they just screen, they screen you. Whereas the American Academy of Dermatology would recommend that you get a skin check by a dermatologist every year. Like that would be the Academy recommendation if you have a first degree relative who's had melanoma. Like that, so I would say, yeah, you should. You should, see a dermatologist. And obviously I'm biased because I'm a dermatologist, but I just know that you're going to get, you know, I don't know. It feels like it's a reasonable ask for you to ask to see a dermatologist.
Well, and that's one of the things we talk about
Yeah.
a lot, like within our community, is advocating for yourself. And so, like you said, we do breast exams, we do, we get our colonoscopies and our mammograms and do all of the things to try to avoid. And so, like, it was very interesting to hear that. So in that situation, it sounds like we just do the self exams, we do the mirror, but then there's the backside of us. My sister
Right.
doesn't have a partner. So
Yeah.
her cancer was on her back. She
Right.
she never saw it. So
And
uh
the back is the most common in men, most common location for melanoma. But you're right. And I laugh because I have a lot of men who come to me and their wives will have circled things on them, so which I love because we laugh about that. But it does, like I said, I want you to show me what you're worried about. And I want them to go home and because, I'm sure they go home and they're like, yeah, I don't know. She said everything was fine. And then, this way, women are much better at that than men. I hate to say it. It's true. But you're right that doing your own check is hard, and it's much easier to have someone look at your back, right? To be able to really see things, and especially to catch melanoma, it is important to catch it as early as possible. So I'm sorry that happened to your sister. I mean, that's scary. It's a scary.
yeah, yeah, and
Yeah,
it's like I said, like I just have to say it out loud, like as much as we can, we have to
yeah,
advocate
yeah.
for ourselves. It's just kind of where we are right now. Uh,
Right.
I did want to, there was a couple of questions that came in. One person said that she saw a study that Fraxel can
Huh.
reduce the chances of or can detect cancer or decrease your chances of skin cancer by 50%. And I'm not quite sure what that is, but
Fraxel is a laser which I don't, obviously I don't do this since I don't do cosmetic dermatology, but it's a laser procedure that does a resurfacing procedure by um, penetrating or poking teeny tiny holes in the skin, and then your body heals that and it regenerates collagen and things like that. And it's true, if you had a lot of precancerous change in the skin, and I didn't spend a lot of time talking about precancer, that's probably the thing I do more than anything, but Fraxel will treat precancers. It wouldn't treat cancer, but it can. So when people come in and they have a lot of sun damage and a lot of precancer spots, a lot of times I have people turn to topical therapy. Like, let's do a cream treatment, treat your whole face, and you're going to look terrible for a couple weeks, but then it peels all that precancerous change away. Fraxel can also do that for you, but it costs like $1,500, so, and you get a cosmetic benefit of having done the Fraxel therapy. But certainly, if money were no object and you wanted to do something to resurface your skin and improve the appearance of your skin, I think Fraxel is great. I would, like I'd love to do that. It sounds great. But it doesn't treat cancer. But it does treat the precancer spots. And so that's probably what they're getting at. And if you, we don't really know this for sure, but when you have a lot of precancerous lesions, if you treat all of those, we probably are reducing your risk of skin cancer. That's why I make people go through all this miserable treatment. Um, we don't know for sure if those precancers are going to evolve into cancer or not. So to be able to say a percentage of reduction of cancer risk, I don't know about that for Fraxel, but that if someone's trying to sell it, that sounds pretty good. But it does work. I mean, it does work for precancer change. So yeah.
And that's the same thing as the creams that are applied.
The creams that are applied are probably, I would guess, more effective because they really are targeted to the precancerous lesions in the skin, whereas Fraxel is kind of resurfacing the skin. So I think you'll see improvement in precancerous change, but I would probably do both things. But if you were considering a cosmetic procedure and had a lot of photo damage and precancerous change, the Fraxel it can be effective. So.
Another question was, oh, well, you touched on both of these. What's your favorite sunscreen?
Yeah,
And
yeah.
which, like self tanners, which do you like? Those were
You
two.
know, it just kind of depends. Like, personally, my face, I don't care if sunscreen on my body, I'll use anything. Like well, whatever we have. And usually we have like my son likes copper tone. I use that. I use the Neutrogena. I like that. On my face, I do use that Elta MD. I had that up one of the pictures. Their tinted sunscreen, is my favorite because it's the only one I've ever used that doesn't sting and burn my eyes. And so I use that one. It's a little pricier, so I always hate to recommend it because it's a little bit more expensive. I think it's like $30 to $40 for a bottle, whereas you can get, Aveeno's Positively Radiant, I think is a very good dupe of that, and it's a little bit cheaper. Um, Neutrogena has come out. I've got some samples in my office, and they're nice of some tinted, nicer sunscreens. Another brand I like is the La Roche-Posay. They have some nice sunscreens out there. They've got some nice cleanser products and lotions and things too. That's another line that I didn't have on my slide, but I like that line a lot. Um, and then what was the other thing? It was
Self
sunscreen.
tanner.
Oh, self tanner. Honestly, that Jergens gradual tan is really good. And it's nice because it's very dilute. So, like someone like me who's never going to get it on evenly and will always end up with streaks, like the gradual tan, like it takes like 4 or 5 days and you have to put it on every day for like 4 or 5 days, but it's just a lotion. It's really easy to rub in and it doesn't smell too bad. Like I am so sensitive to smell. I generally don't like the smell of self tanner. But that's probably my favorite. But there are some actually another thing that I've come across lately I think it's called Tan Luxe, Luxe, and it's a liquid dropper. And you can actually put as much as you want into your own favorite lotion. So I'll mix it with like my CeraVe cream and I'll use that. I think that's really nice. I go occasionally to the spray tan place and I'll not like I go to there's now in Woodland Natural Glow. Those ladies are really nice. It's a taste of my own medicine because I have to stand there naked, and I'm like, oh my God, this is terrible.
Mm.
And and I don't love inhaling, I worry a little about them, but if I'm going somewhere or I've got a wedding to go to and I want to have a tan, I'll do the spray tan. But for me, sometimes I just end up too dark. I don't like having too much color. So that's why I like that natural glow. I think it works well.
Okay, wait, there was one here. Oh, so we have a few people that are and that this was a write-in because I am personally on the East Coast right now, but this was
Oh,
from
God,
somebody
late.
that's on the East Coast.
Yeah.
And they said vitamin, and you touched on this, and she said we just don't get much vitamin D here, which I can attest to because there was a rainstorm here today.
Right, right,
And what are your thoughts on like because you touched on I mean, in California,
right. We get a lot of
vitamin D is not a concern. But
I
for
mean,
most
yeah,
people,
I mean,
East Coast,
it's one of those things that I think it's really interesting that so many people are showing up with low vitamin D levels. Like it's just,
it,
you get your blood checked and your vitamin D is low, and it's just extremely common. I don't really think that sunlight is going to increase your vitamin D level very much. So all it takes, even in the East Coast, is just a few minutes, like on the backs of your hands, or, a little bit of sun here and there. You don't need to deliberately sit in the sun to get vitamin D. And probably where we're lacking the vitamin D is our diet. And that's probably where the vitamin D problem is coming from. I really don't think it's the sunlight so much. And, I live in Davis. Everyone here is very well educated, and, I've got lots of patients who tell me they need to sit in the sun for this many minutes a day. And, I mean, I'm never going to tell people not to be outside and not, live your life, do your things. I think being outdoors is really good for us. And I am sad for kids today. Like, I spent my entire childhood outside. And I would never discourage people from doing that. I just think there's moderation, or there's ways to protect your skin from the sun. And I think deliberately lying out in the sun is just, I don't know. And I see so much skin cancer. It's hard for me to ever justify someone doing that. So I try to talk people out of doing that. The other thing is that ultraviolet light releases endorphins in our brains, and it makes us feel good. And so for that reason, I do think it's okay, to get some sun in your life, I think is okay. But trying to justify it by saying vitamin D, I guess I kind of feel like it's a way for people to say, this is why I want, I'm going to sit outside because I want to, but it's really because I want my vitamin D. And I'm not sure that your vitamin D levels are going to go up if you spend that much more time in the sun. I think it really is more dietary than sunlight. So, but
Which
anyway,
of course
I
I
mean,
love.
I spent 10 years in
I'm all
Vermont.
about getting it through nutrition. So I
Yeah,
love
yeah,
hearing you say that. Like
yeah,
let's
yeah.
get our let's
Get
give you
our, well balanced, more fish and, other, healthier vitamin D heavy foods in our diet is probably the way to go with vitamin D, I think.
another question was I always thought that getting a base tan
Mhm.
was the right way to go because it would fend off a sunburn. What are your thoughts on that?
I would definitely say not a good idea because, every tan, I mean, is showing what a tan is your body trying to protect itself from the sun. Those melanocytes are making, pigment to try to protect you from the sun. So, a tan is a sign of sun damage. There are people out there who tan very easily, and so it's just different. I mean, if you're have red hair and fair skin, you're never going to get a tan, and so there's no point in trying. I mean, it's generally a tan is generally not good for you. But there are certainly people out there who have the type of skin that they can spend, they can be in the sun 10 minutes, they get tan. They're probably never going to get skin cancer. They're not the population that I'm seeing or that I'm really talking to. Like, if you really do have a dark complexion and tan really easily, your risk of cancer is quite a bit, really probably quite a bit lower. Um, but again, I wouldn't go out there. I don't think a base tan helps you in any way. So
Yeah, that was a good one because I was
yeah,
like, oh, I like that question.
yeah, yeah, base tan. I know. I like the idea. I grew up in the 70s and 80s. I know, we were supposed to be tan all the time. So
Yeah. Any other questions out there? No, Megan, this has been
I
so.
have a question if I
Oh,
could ask. Sorry, first of all, I'm sorry I joined so late.
you're
Um,
totally good.
so my question is, I'm not a skin cancer patient, I'm a breast cancer patient, but I have radiation, I mean not radiation, I have open wounds from surgery that I had, chest wall
Yeah,
reconstruction surgery that I had last May, and they still haven't healed completely. So we're doing dressings on them every other
yeah.
day, and
oh,
then the radiation that I had just made them worse. It made them go backwards a little bit. So I was wondering if there's anything that you know about for to help wound healing.
Probably not more than what your, wounds. I'm sorry that's happening to you. It's because you're right. The radiation on top of everything else does make the healing
Mm.
much slower. Are you seeing wound? Do you go to a wound care
Yeah, I'm seeing wound
specialist?
clinic
Yeah,
at
yeah.
UC Davis.
They have great new, I mean, I often refer to wound care just because There's so many new products out there that kind of
Mm-hmm.
mimic the skin and create what you want is a barrier, like trying to recreate the barrier of the skin. And
Mm-hmm.
there's a lot of new products out there that do a good job, and mostly that's become, what the wound specialists have access to. So
Mm-hmm.
I would imagine if you're at UC Davis Wound Care, you really are getting, top-notch care there. And
Mm-hmm.
I wish I had some magic, bullet for that. It's really challenging, and I've had a lot of patients over the years with challenges like that. It can be really hard, so I'm sorry
Yeah.
for that.
Thank you. Thank
You're
you.
welcome. Yeah.
That was a good question, honey.
Yeah, I'm sorry I'm not more helpful with that, but
No, thank you.
It was helpful for sure. Anyone else? We'll let you all get back to your dinners and your evenings. Meghan, thank you again for educating our community
oh, my
and
pleasure.
being a
Thank
part of
you.
our community and allowing us to share this, like answering the questions for those that couldn't be on the call, and then supporting the people that were on the call. We really appreciate you.
Thank you very
Yeah.
much.
Oh, you're welcome. And Jen, thank you for all you do. I know how much you give to the community, and I really appreciate everything that you do. So thank you for thinking of me. I'm flattered.
We appreciate you.
Yeah.
Have a great
Okay.
evening,
All
everyone.
right.
Night, everybody.
Thank you so
Thank
much.
you.